Hello everyone. Last part we have seen about detailed narration of each etiological factors which will be causing or promoting the condition thromboangiitis obliterans. So in this part we will see mainly about pathophysiology and some commonest factors which will be promoting or which will be having adverse effects over the further preceding stages of thromboangiitis Obliterans. So myself, Dr. Anandas, Assistant Professor, Department of Roganidhana and Vikriti Vignan, Global Institute of Ayurveda, Rajkot. So consider pathogenesis of thromboangiitis obliterans, particular effects over endothelial cells we have to discuss, and effects over the platelets and the characteristic changes of leukocytes and effects over the sensory neuron. So within these four elements, we have to see what and all changes and what and all features we can observe over the condition of thromboangiitis obliterans. And among that factors also some commonest factors which will be promoting further conditions of thrombosis along with the angiitis condition, that it will be combinedly joined or it will be considered as thromboangiitis obliterans. So influence of host characteristics such as male gender and genetic background, what are the feature or the role of genetic background of the patient, along with within that also particularly some predilection towards male gender and probable triggering factors considering cigarette smoking and in some role of infectious agents, how it will be influenced over the promotion of the condition called thromboangiitis obliterans. Along with that, environmental factors, particularly chronic anxiety, including mental stress also. So this much promoting factors also should be discussed under the pathophysiological aspect of thromboangiitis obliterans in order to give a clear-cut idea about the formation of thrombosis along with angiitis. Whenever discussed regarding pathophysiology of TAO, it can be classified as acute phase, subacute phase, and chronic phase. So, in within each phase, we can see characteristic changes of components like formation of thrombus and thereby causing formation of microabscesses and thereby forming the other characteristic features over the vascular wall. So, within the acute phase, what will be happening? There will be particularly thrombus formation will be occurring within the vascular wall, and the typical character of the thrombus will be hypercellular in nature and along with the minimal inflammatory features. So in an acute phase it will be shown like thrombus formation within the vascular wall with the minimal inflammatory characteristic features, but it will be hypercellular in nature along with the inflammatory thrombus characteristic feature present also. Thereby, it will be leads to the subacute phase. What will be happening with the subacute phase? Within the acute phase, the characteristic thrombus formation will be there within the affected vessel, and thereby the next level subacute phase, particularly the polymorphonuclear leukocytes, the PML leukocytes, will be predominant in nature. Within that subacute phase, the majority of the cells will be polymorphonuclear leukocytes only. Within that site of inflammation, those cells will be majorly seen, and thereby it will be forming micro abscesses within the thrombus. So in the subacute phase, within the thrombus, micro abscesses will be forming along with presence of PMN leukocytes. So wherever the thrombus getting mature or wherever it will be going with the further condition in the subacute phase, the polymorphonuclear leukocytes within which will be present in the microabscess will be surrounded by a granulomatous inflammation. So thereby it will be coming with the next stage of a chronic phase or gradually preceding or adjacent with or adjoining with the next stage of pathophysiology chronic phase, which will be happening along with the further maturation or along with the further characteristic changes of the features also. So what will be happening? The polymorphonuclear leukocytes, which will be present within the microabscesses, will be surrounded by a granulomatous inflammation that will be lead to further organization and recanalization of the thrombus. There will be happening further organization, recanalization of the thrombus itself. Finally, the mature thrombus with vascular fibrosis is observed in the end stage phase. Nothing but in the chronic stage phase, the mature thrombus along with the vascular fibrosis, further fibrosis features will be also present over that thrombus. So at the end stage or the chronic stage, we can find out or we can observe a thrombus with the mature complete characteristic with fibrosis or vascular fibrosis features. According to some view, it has been suggested, it has been shown that the first event will be thrombus formation with respect to further inflammatory response towards the inflammatory procedures. So according to some authors, according to some views, it has been stated that wherever the inflammation is at first limited to the vascular lumen particularly, then it will extend to the adjacent structures particularly and thereby accompanying the affected artery. After the inflammation, thereby it will first limited to the vascular lumen and that will be extend to adjacent structures along with the affected artery. But in some cases, some other point of opinion that it has been proposed like there will be an unknown presence of antigen. There will be presence of an unknown antigen, particularly in the intima layer, and thereby it is causing vasculitis. So within that controversies, the acute intimal inflammation may induce microabscess and thrombus formation. So depends upon each phase or depends upon each stages, different types of opinions are there. Presence of an unknown antigen will be causing or it will be inducing vasculitis or thereby causing further intimal inflammation or formation of or inducing microabscesses and thereby leading to thrombosis formation. Or apart from that, some conditions regarding inflammation at the first site of attack and thereby at the vascular lumen, and from there it will extend to adjacent structure and along with accompanying of affected artery. So these type of controversies also present along with the pathogenesis of or further progressive stages of TIO along with acute phase, subacute phase, chronic phase. But moreover, in acute phase, there will be a thrombus formation with the minimal inflammatory characteristic features. Thereby, it will be going to subacute phase where formation of the starting stage of formation of microabscesses with the influence of polymorphonuclear leukocytes, thereby further recanalization and granulation along with further formation and organization of microabscesses at the end stage or a chronic phase. Particularly formation of a CD68 macrophages and S100 dendritic cells having that influence over the further inflammatory process over the vascular wall or the endothelial lining of the artery. So thereby it will be causing the or thereby it will be having the influence or appearance of these kind of CD68 macrophages types or leukocytes along with S100 dendritic cells in the particularly in the intima layer at the acute and subacute phase. Particularly at the subacute and acute phase, it has been seen or it will be seen presence of CD68 and macrophages dendritic cells in case of a TIO. That has an influence over the presence of an unknown antigen at the site of thrombus formation. So thereby, if it all presence of CD68 macrophages along with the S100 dendritic cells, it has a alarming sign or has a warning sign like there will be presence of an unknown antigen also at the site of thrombus formation. And after the onset of acute phase or after the completion of acute phase, what will be happening? More TCD4 and fewer TCD8 lymphocytes will penetrate into the thrombus and the vascular fold. So further penetration of these kind of TCD4 cells and TCD8 type of lymphocytes will be particularly penetration will be happening at the vascular wall. The TCD4 cells along with which may be involved in the pathogenesis of the disease are more likely to form a T helper, particularly Th1 immune response and thereby causing the further changes of the pattern of the inflammatory processes because the granuloma formation, particularly CD8 cells and the Th1 dependent class of immunoglobulin associated with the TA morphology. So along with the influence of TCD8 type of cells, Apart from that, influence of Th1 T helper cells 1 has the dependent characteristic feature over or role over the further TAO morphological changes along with the immunoglobulin IgG. So this will be imply that effects over the vascular layers with further characteristic changes or morphological changes over the endothelial lining along with the integrity or adhesion of a vascular walls also or vascular bed also. So as we have seen already in previous slide, the TCD4 cells, particularly the cells having that influence over inflammatory processes and having influence over the immune system also, which may be involved in the pathogenesis of the disease TIO, are more likely to form a T helper Th1 immune response pattern because of the granuloma formation. So there will be onset or formation of an immune response as TCD4 cells particularly having that characteristic features like it can enable with the immune system of the cells, particularly the neutrophils, eosinophils, basophils, reactivating that kind of cells. So there will be onset or there will be startup of a immune response program because of the granuloma formation within the disease itself. The TCD8 plus cells, the other type of cells which will be having the same kind of activity or property, enabling with the immune response or further inflammatory responses to counteract with the actions, and the Th1 T helper 1 dependent class of immunoglobulin IgG are associated with the TAO morphology. The TCD4 plus cells other category orchestrate the cell mediated immune response and provide accessory signals for B cells to elicit antibody production. So whenever there will be an inflammatory action or inflammatory procedures, there will be further enabling with the cells TCD4 cells particularly acting along with the other cells or the inflammatory cells. There should be a help or there should be a proper analyzing and proper conduction of the property along with cell mediated immune response also, and thereby causing further giving further actions or further signals for the B cells to continue with antibody production. Interestingly, both antibody and complement factors deposit linearly along the elastic lamina in the implicated tissues. So over the vascular beds or over the affected vascular wall or artery, there will be antibody and a complement factor will be deposition of the antibody and complement factors will be linearly over that elastic lamina in that implicated tissue region. So, considering as a promoting factor, smoking and its effects over platelets we will discuss here. So, whenever you consider the patient of having a habit of chronic smoking or chain smoking, it will intercept with increase the platelet activities like platelets having its own activities like adhesiveness and aggregation. So, whenever it will be considered with regards to the patient of a chronic smoking, it will have that adverse effects of the platelets like platelet having its own adhesiveness property and aggregation in higher in nature. So thereby it will cause with reduced platelet and higher the serum level of a von Willebrand factor. Particularly von Willebrand factor will be having influence over hemostasis, causing or helping in the platelet activities as well, and has been reported among cigarette smokers, particularly within that chronic people having chronic cigarette smoking. There may be a chance of a reduced platelet, and there will be higher the serum level of a von Willebrand factor also, according to studies. Alterations in the metabolism of T-excitol thromboxane A2 is a type of thromboxane, and prostacyclin also occur in response to cigarette smoke. So both these components T-excitol thromboxane A2 and prostacyclin, which will be enabling with further platelet activities. And in cases of chronic smoking or with the patients, studies have been conducted and proved that there will be some alterations in the proper metabolic activities of both type of thromboxane and along with the prostacyclin component. Platelet expression of a P-selectin and glycoprotein, particularly glycoprotein second B or third A, which is a fibrinogen receptor necessary for normal platelet aggregation and endothelial adherence increases. So there will be, with considering these two factors, particularly glycoprotein second B and third A, that will be a fibrinogen receptor. There will be increased adherence or adhesion property will be more in nature and thereby causing more platelet aggregation also. P-selectin, a cell adhesion molecule that appears on the surface of activated endothelium and activated platelets. P-selectin interacts with the glycoprotein second B or third A during thrombus formation. So, during the mechanism, the P-selectin component will be interact with glycoprotein in order to go with further formation of a thrombus within the vessel walls. Increased expression of this adhesive molecule on platelets and endothelium due to smoking leads to recruitment of leukocytes and further inflammation. So thereby it will continue with the further recruitment of or further uh, supply of leukocytes in order to continue with inflammatory processes. Along with adhesion molecule will be there on platelets and endothelial procedures also in cases of chronic smoking. Particularly the content or the chemical component will be present in the smoking. It will be happening. Nicotine content increases the plasma level of epinephrine and ACTH, adrenocorticotropic hormone, by affecting HPA axis, hypothalamus pituitary axis. Particularly the content of nicotine, it will be having the adverse effects over the two hormones, particularly epinephrine and ACTH. And P2Y12, particularly the major platelet receptor, it will be mediating the ADP processes, induced aggregation on a vascular cells. So, if at all there will be influence over these components along with the ADP or other ACTH related hormones, it will induce the aggregations in vascular wall regions. Cigarette smoke activates platelets to release the contents of their dense granules, including ADP, serotonin, epinephrine, and norepinephrine. So whenever inhibition of ADP degradation in chronic smokers may lead to extensive platelet activation and vascular inflammation. So particularly consider the inhibition of the ADP component, and there will be continuing with the degradation in chronic smokers. That condition will lead to extensive platelet activation in order to compensate the condition and thereby continue with the further vascular inflammatory processes also. And adverse effects of leukocytes, the second promoting components. Leukocytosis has been suggested as a risk factor for recurrent arterial thrombosis associated with some diseases, including polycythemia vera and essential thrombocythemia. So, two clinical conditions we will discuss here: polycythemia vera and essential thrombocythemia with respect to leukocytosis condition. Smoking induces brief leukocytosis and a delayed increase in the neutrophil activation, and thereby it will cause production and secretion of oxygen-derived free radicals from activated neutrophils in one possible mechanism for the pathogenesis of TNA. So consider the several pathological considerations or pathological process of TAO. Production and secretion of oxygen-derived free radicals from the neutrophils as a result of leukocytosis, that will be considered as one possible mechanism for a pathological process of TAO. These oxygen radicals can then alter endothelial morphology or function, thus promoting adhesion molecule expression and contributing to the risk of thrombosis and inflammation. So wherever release of these oxygen free radicals are there or oxygen derived free radicals are there, that will be considered with further functioning or further alteration of endothelial morphology and thereby altering the function of the endothelial lining, thereby promoting with the action of adhesion molecule expression along with the risk of thrombosis and inflammation. So this was regarding the adverse effects regarding smoking with respect to leukocytes. Smoking and the effects of endothelial cells. Several studies have demonstrated endothelial dysfunction and inflammatory molecule expression in TIO. The endothelium dependent vasodilation, particularly mediated by nitrous oxide, is diminished in TIO patients while a higher level of circulating markers of inflammation such as intracellular adhesion molecule ICAM1 has been reported. So according to the studies have been conducted over adverse effects of smoking and endothelial cells, it has been shown that a particular endothelial dysfunction and inflammatory alteration as a result of smoking is that has been proved according to the studies. So, endothelium dependent vasodilation, particularly, it will be activated or mediated by nitrous oxide molecules. It will be diminished, it will be decreased in conditions of a TIA patients. It has been shown like that, and with a at the same time having a higher level of circulating markers of inflammation. Same time, it has been shown that higher the level of inflammatory markers also, particularly ICAM presence. Nicotine in cigarette smoke provokes an increase in the expression of pro-inflammatory cytokines, inflammatory mediators, and inducible NO synthase in the vascular wall and increases endothelial expression of adjacent molecule, including ICAM. So the nicotine content present in the tobacco-like things, it will be having that affinity towards the further endothelial dysfunctions, causing it will provoke or increase in the expression of pro-inflammatory cytokines along with the inflammatory mediators. There will be having that inducible act of nitrous oxide synthase in your component, particularly in the vascular wall, and there will be increasing endothelial expression of adjacent molecule, including action of or inflammatory process of ICAM, intercellular adjacent molecule action. Cigarette smoke and the tar component in particular can directly promote vascular oxidative stress in systemic vascular beds and produce generalized endothelial dysfunction by reducing NO or nitrous oxide bioavailability. So with respect to the smoking or the chronic smoking or chain smoking, the presence of tar component in the cigarette smoke or in the other smoking materials, it can be directly influence or can directly promote a vascular oxidative stress like actions in a systemic vascular beds of the vascular walls and thereby causing endothelial dysfunction directly by reducing NO bioavailability. So there will be reduction of NO bioavailability. Typically, nitrous oxide inhibits platelet aggregation and adhesion of inflammatory cells to endothelial cells, allowing a normal blood flow. So particularly the NO, it will inhibit our platelet aggregation, normal in case, and it having a property of adhesion of inflammatory cells to endothelial cells, particularly endothelial lining, allowing a normal blood flow. So this means regarding the consequences or adverse effects of smoking with respect to platelets, with respect to leukocytes, and with respect to endothelial cells. So other promoting factors like infectious agents and environmental factors, predisposing factors, complications, along with the clinical features, and just a general introduction regarding the diagnosis of the condition TIO, we will discuss in the next part.